A year ago, this would be the 1st of October, 2024, my mom was dying. My dad had passed away during the summer, and my mom was very feeble. She had more physical strength than my dad did, and it was unpredictable. You know, the last time that I saw her during the same summer that I went to basically bury my dad, we went up, Sugi and my best friends, Doug and Joe, and I went up to Ottawa to see my mom. And I knew that she was declining, but I thought that she might still have another year, another 2 years. She had that sort of vibrancy still, physically, even though she had deteriorated very badly intellectually. In any case, she had a crisis on September the 13th. The head nurse at her nursing home contacted me and told me that she had stopped eating and drinking. Now, what happened from the time that I got that email message, which was around 8 a.m. my time, and the time that I was able to contact a doctor at the nursing home who was taking care of the patients, was there was a sort of a break of around, say, 17 hours or something like that. I finally got a doctor around 1 a.m. the following day. In other words, from 8 a.m. to 8 p.m. my time, 12 hours, plus 5 hours more. I was not able to get anybody but a nurse, and the nurses simply didn't give me an essential piece of information, which was that my mom probably had a UTI. All that I had to work on was that she had stopped eating or drinking, and the implication was that the death process had happened. Now, my mom, unlike my dad had these ups and downs too, but in my mom's case, my mom had severe ups and downs. I was told in 2020, September 2020, that she was definitely, absolutely, categorically going to die. 2 doctors, not just one, told me that with absolute certainty. It's very rare for doctors to be that sort of absolute in their diagnoses. But in this case, that's what the doctors said, and the doctors turned out to be wrong. I did feel that with my mom, it would have helped if I'd found out earlier that what was causing her fever, which in turn was causing her lack of interest in eating and drinking, was a UTI. When my wife, a retired nurse, heard this, she said immediately, that's easy to treat. So I asked the doctor at the home to send her to Emerge at a hospital, not a nursing home, and see what they could do. And he agreed to do that. Now, as it turned out, she was in dire shape, and the doctor that I spoke to at the nursing home advised me that he thought it was too late, really, and that I should just let her go. She was going to die that weekend, September 13th, 14th, 15th. Around that time frame, if I had done nothing, she would have died. As it turned out, she lasted until October the 8th. So she did still have a bit of vitality left in her. I wish I'd found out sooner about the UTI as a probable cause. These are the sorts of miscommunications that can have a big impact on sort of what happens with an elderly person. Now, I've posted on this before, and what I found was that people who had been through somewhat similar experiences became very defensive in some cases and said that I was interfering with her death process, I didn't understand the dying process, etc. They're being very judgmental, I thought. Emotions tend to run high with this sort of situation. My mom, in the end, I think died peacefully. I'm not angry at anybody, but I do think that the nursing home really should have explained all the medical details, the pertinent medical details to me much more quickly.